Let me describe a person. Tell me if this sounds familiar. They take metformin for blood sugar. They take a statin for cholesterol. They take lisinopril, or maybe amlodipine, for blood pressure. 3 conditions, 3 pills, 3 copays, 3 sets of side effects. And every 6 months, their doctor adjusts the doses, usually up, rarely down. That's not healthcare, that's maintenance. You're being managed, not healed. Now let me tell you about a compound. One compound. It lowers fasting blood sugar. Published, peer-reviewed, meta-analyzed across 46 clinical trials. It lowers total cholesterol and LDL cholesterol. Same body of evidence, same compound. And it lowers blood pressure through a mechanism so elegant that when I first read the research, I sat at my desk for 10 minutes, just staring at the screen. One compound, 3 conditions. And the side effect profile? In double-blind randomized trials lasting 3 months or longer, comparable to placebo. This is not a miracle herb I found on the internet. This is a compound that's been used in traditional medicine for over 2,500 years, and has been validated by modern science in some of the most rigorous clinical trials you'll find in any journal. So why has your doctor never mentioned it? That's actually a fair question, and the answer isn't what you think. It's not a conspiracy. It's not that doctors are being paid to suppress berberine. That's too simple, and it doesn't give doctors enough credit. The real answer is structural. Medical school doesn't teach natural compounds. Residency doesn't cover them. Continuing medical education conferences are sponsored by pharmaceutical companies, not herb distributors. The prescribing software your doctor uses doesn't have berberine in the drop-down menu. Insurance doesn't cover it. And in a 12-minute appointment where your doctor is managing 5 conditions, ordering labs, reviewing medications, and documenting everything for compliance, there simply isn't time to say, "Have you considered a 2,500-year-old Chinese botanical?" It's not malice, it's infrastructure. The system wasn't built for this. And that's exactly why channels like this one exist. I'm going to walk you through all 3 mechanisms tonight, one at a time, the blood sugar evidence first, then cholesterol, then blood pressure. And at the end, I'll give you the exact dosing protocol, the 4 combinations you must absolutely avoid, and what to realistically expect, week by week, for the first 12 weeks. This is Senior Health Blog. And tonight, I might make 3 pharmaceutical companies very uncomfortable. Here's what most people don't understand about blood sugar, cholesterol, and blood pressure. They're not 3 separate problems. They're one problem, wearing 3 masks. The medical system treats them separately. You see an endocrinologist for diabetes, a cardiologist for blood pressure. Maybe your primary care manages cholesterol. 3 specialists, 3 waiting rooms, 3 billing codes. But underneath all 3 conditions is a single dysfunction, and that dysfunction has a name. Insulin resistance. When your cells stop responding efficiently to insulin, which happens gradually after age 40 and accelerates after 60, 3 things cascade simultaneously. First, glucose stays in your blood because your cells won't absorb it properly. That's your high blood sugar. Second, your liver compensates by producing more very low-density lipoproteins, which drives up triglycerides and shifts your cholesterol profile toward the dangerous pattern. That's your bad cholesterol numbers. Third, the chronic inflammation from elevated glucose and insulin damages the lining of your blood vessels. The endothelium, that delicate inner layer, becomes stiff, less responsive. It stops producing enough nitric oxide, which is the molecule that keeps your arteries relaxed and flexible. That's your high blood pressure. 1 root cause, 3 symptoms, 3 pills. But what if you could address the root cause itself? What if there was a compound that activates the same metabolic master switch that exercise activates? A switch that simultaneously improves how your cells handle glucose, how your liver processes cholesterol, and how your blood vessels produce nitric oxide. There is, and the research goes deeper than I ever expected. The compound is called berberine. Now, before you do what most people do, before you pull out your phone and search berberine supplement, stop. Please, give me 30 minutes. Because how you take this, when you take it, what you take it with, and what you absolutely must not combine it with, those details matter more than the supplement itself. Let me tell you what berberine actually is. It's an alkaloid, a naturally occurring chemical compound found in several plants: golden seal, Oregon grape, barberry, and a Chinese herb called Coptis chinensis. The yellow color you see in golden seal root? That's berberine. Traditional Chinese medicine has used Coptis chinensis for over 2,500 years, originally for digestive issues, for diarrhea specifically. That's a humble beginning for something this powerful. And it wasn't just China. Ayurvedic practitioners in India used the berberis plant, which contains the same compound, for similar purposes. The herb appears in Egyptian medical texts. The Greeks used barberry medicinally. For millennia, across cultures that never communicated with each other, healers independently discovered that this yellow pigmented plant compound helped the human body. They didn't know why it worked. They just knew it did. It took modern science another 2,500 years to catch up. In 2004, a team at the Chinese Academy of Sciences published a study in Nature Medicine. And if you know anything about scientific journals, Nature Medicine is the top tier. They demonstrated that berberine lowers cholesterol through a completely unique mechanism, by increasing the expression of LDL receptors on liver cells through a pathway distinct from statins. That was the first major Western validation. Then, in 2008, the landmark study that changed the conversation entirely. Researchers at the Shanghai Institute of Endocrinology published a trial in the journal Metabolism comparing berberine head-to-head against metformin in newly diagnosed type 2 diabetic patients. The results were, honestly, they were the kind of results that should have been front-page news. But they weren't, because you can't patent a plant compound that's been used for 2,500 years. There's no $12 billion market cap waiting on the other side of a berberine FDA approval. Nobody was paying for full-page ads in medical journals. So the study sat there, peer-reviewed, validated, ignored by mainstream medicine. The results were remarkable. Berberine reduced HbA1c from 9.5% to 7.5%. It reduced fasting blood glucose from 10.6 to 6.9 millimoles per liter. And it lowered triglycerides and total cholesterol significantly. And here's the line from the study that made researchers around the world sit up straight. The hypoglycemic effect of berberine was similar to that of metformin. Similar to metformin, the most prescribed diabetes drug on the planet. That single study triggered an avalanche of research. And over the next 15 years, the evidence didn't weaken. It got stronger and wider. Because researchers started finding that berberine doesn't just affect blood sugar. It affects everything connected to it. Let me show you how, one system at a time. Most blood sugar supplements work on the surface. They might slow carbohydrate absorption, or they might provide a mineral your body needs to process glucose, like chromium or magnesium. Berberine doesn't work on the surface. It works at the level of a cellular switch. The switch is called AMPK, adenosine monophosphate activated protein kinase. I know that's a mouthful. So let me simplify it. Think of AMPK as your body's fuel gauge. When AMPK is activated, it tells every cell in your body, hey, we need energy. Start burning glucose. Start burning fat. Get to work. When AMPK is dormant, which happens more and more as you age, as you become more sedentary, as insulin resistance builds, your cells are basically asleep at the wheel. Glucose is floating around in your blood, knocking on the door of your muscle cells, your liver cells, and nobody answers. You know what else activates AMPK? Exercise. When you go for a brisk walk, your muscles activate AMPK to pull glucose in. That's a huge part of why exercise helps blood sugar. Your cells wake up. The doors open, glucose flows in. Berberine activates that same pathway. Not identically, I want to be precise about that. The mechanisms overlap, but aren't identical. But the downstream effect, the result, is remarkably similar. Your cells start responding again. Now, let me walk you through what the clinical evidence actually shows. Because I don't want you taking my word for this. I want you to see the data. A 2021 meta-analysis published in Oxidative Medicine and Cellular Longevity. This is a study of studies, meaning researchers pooled data from 46 separate randomized controlled trials involving over 4,000 participants. Analyzed what happens when people with type 2 diabetes take berberine. The results were consistent across trials. Berberine significantly reduced fasting blood glucose. It significantly reduced 2-hour post-meal blood glucose. That's the number that spikes after you eat. And it significantly reduced HbA1c, which is your 3-month average. The HbA1c reduction averaged 0.73 percentage points. Now, that number might not sound dramatic to you. So let me put it in context. Many first-line diabetes medications, drugs that cost hundreds of dollars a month and come with pages of side effects, achieve reductions of 0.5 to 1.0 percentage points. Berberine is sitting right in that range, from a plant compound that costs $15 to $20 a month. But the blood sugar story goes deeper than just, it lowers glucose. See, berberine also reduces something called HOMA-IR. That's a measure of insulin resistance itself, not just blood sugar, insulin resistance. The underlying problem, the root cause. The meta-analysis showed a significant reduction of 0.71 in the HOMA-IR score. What does that mean in plain language? Your cells are becoming more responsive to insulin. The doors are opening again. Your pancreas doesn't have to scream louder to get the same response. And fasting insulin levels dropped too, by an average of 2.05 microunits per milliliter. That's your pancreas being allowed to rest, to recover. It doesn't have to pump out massive amounts of insulin because your cells are actually listening again. Think about what that means for someone who's been insulin resistant for 20 years. Your pancreas has been overworking for 2 decades. It's exhausted. Beta cells are wearing out. And now, something is finally reducing the workload. Now, I want to be careful here because I know exactly what some of you are thinking right now. Can I stop my metformin? No. Not without talking to your doctor, and I'm not suggesting berberine replaces medication. That's not my place to say. What I am saying is that the evidence shows it works through similar mechanisms and produces comparable effects in certain patient populations. That's remarkable for a plant compound, and it's information your doctor should have. There's one more aspect of the blood sugar effect that I need to mention, because it connects directly to what happens after dinner. Berberine reduces something called hepatic glucose output. That's the glucose your liver manufactures and dumps into your bloodstream, particularly overnight and between meals. In people with insulin resistance, the liver often overproduces glucose. That's why your morning fasting number is high, even when you didn't eat anything for 12 hours. Your liver was busy all night, making glucose you didn't ask for. Berberine appears to reduce that nighttime glucose production, which means your morning numbers might start making sense again. And actually, that whole nighttime blood sugar issue, it's something I spent months researching. The overnight liver dump, the cortisol surge at 3 a.m. The reason your morning number doesn't match what you ate the night before. I put all of it into a guide called The Midnight Insulin Trap. Link is in the description. But let's keep going. Because what berberine does to cholesterol is honestly even more impressive than the blood sugar data. Now this is where berberine separates itself from almost every other natural compound I've ever reviewed. Most natural cholesterol remedies, red yeast rice, plant sterols, fiber supplements, they work on one aspect of cholesterol metabolism. Maybe they block absorption in the gut. Maybe they provide a mild statin-like effect. Berberine attacks cholesterol from multiple angles simultaneously. Let me explain the primary mechanism first, because this is genuinely fascinating. Your liver has receptors on its surface called LDL receptors. Think of them as tiny hands reaching out into your bloodstream, grabbing LDL particles, the bad cholesterol, and pulling them back into the liver for processing. The more LDL receptors you have on your liver cells, the more LDL gets cleared from your blood. Statins work partly by increasing the number of these LDL receptors. That's one of the reasons statins lower LDL so effectively. Berberine also increases LDL receptor expression on liver cells. But, and this is the critical distinction, it does it through a completely different pathway than statins. Statins work by inhibiting an enzyme called HMG-CoA reductase, which blocks cholesterol production inside liver cells. When the liver can't make enough cholesterol internally, it responds by putting more LDL receptors on its surface to grab cholesterol from the blood. Berberine works through AMPK activation, which stabilizes the messenger RNA that codes for the LDL receptor. In simpler terms, berberine tells your liver cells to keep their LDL receptors active for longer. More receptors, more grab, more clearance. Two different mechanisms, same result. Lower LDL. And this is why a 2008 study published in Nature Medicine found something remarkable when berberine was combined with a low-dose statin. The combined LDL reduction was greater than either one alone. The researchers reported a 46% reduction in LDL cholesterol with the combination, compared to about 27% with berberine alone and about 28% with simvastatin alone. That's not addition, that's synergy. Two different pathways amplifying each other. Think about what that means practically. If someone is on a statin but can't tolerate a higher dose because of muscle pain, because of liver concerns, because their body just doesn't respond well to more, berberine might allow them to achieve better cholesterol control at a lower statin dose. That's the conversation worth having with a doctor. Not, can I quit my statin? But, can I stay on a lower dose and add something that works through a different mechanism? That's smarter medicine. That's how combinations should work. Now, the meta-analysis data on cholesterol is robust. Across multiple trials, berberine significantly reduced total cholesterol, triglycerides, and LDL cholesterol while increasing HDL cholesterol, the protective kind. The triglyceride reduction alone, averaging around 0.5 millimoles per liter, is clinically meaningful for people with metabolic syndrome. And the original 2008 study from Shanghai found something that made the cardiology community take notice. In the regulation of lipid metabolism, berberine actually outperformed metformin. By the 13th week of the trial, triglycerides and total cholesterol in the berberine group were significantly lower than in the metformin group. That's a head-to-head comparison in a randomized trial, published in a peer-reviewed journal. These aren't anecdotes. But there's a piece of the cholesterol story that almost nobody talks about. And it's the piece that matters most for people over 60. It's not just about the numbers on your blood test. It's about what's happening inside your artery walls. When LDL particles get oxidized, which happens more aggressively in the presence of high blood sugar and chronic inflammation, they become what scientists call oxidized LDL. And oxidized LDL is the form that actually triggers plaque formation. Regular LDL floating in your blood? Not great. Oxidized LDL embedding itself in your artery walls? That's what causes atherosclerosis. Research has shown that berberine has strong antioxidant effects that specifically reduce LDL oxidation. It inhibits the production of reactive oxygen species in endothelial cells. It protects the cells lining your blood vessels from the damage that oxidized LDL causes. So berberine isn't just lowering the number of LDL particles. It's making the remaining particles less dangerous. That's a fundamentally different conversation than most cholesterol discussions. And it connects directly to the third act. Because those blood vessels I just mentioned, the endothelium that berberine is protecting from oxidative damage, that same endothelium controls your blood pressure. All right, this is the part of the research that genuinely surprised me. Because the blood sugar data? I expected that. The cholesterol data? Impressive, but I could see the logic. The blood pressure mechanism. This I did not see coming. Most blood pressure medications work through one of a few mechanisms. ACE inhibitors block a hormone that constricts blood vessels. Calcium channel blockers relax the smooth muscle in artery walls. Beta blockers slow your heart rate. Diuretics reduce blood volume. All of these work from the outside in. They force your blood vessels to behave. Berberine works from the inside out. Here's how. Inside every blood vessel in your body, there's a single layer of cells called the endothelium. This is your vascular inner skin. And the endothelium has a critical job. It produces a molecule called nitric oxide. No. Nitric oxide is the molecule that tells your blood vessels to relax, to dilate, to stay flexible. When you have enough nitric oxide, your arteries are supple and responsive. Blood flows easily. Pressure stays normal. But after age 60, nitric oxide production declines significantly. The endothelial cells become damaged by years of high blood sugar, oxidized LDL, and chronic inflammation. They stop producing enough nitric oxide. Your arteries become stiff, resistant, and your blood pressure goes up. This is why blood pressure often rises with age, even in people who eat well and exercise. It's not just salt. It's not just stress. It's endothelial dysfunction. Your inner vascular lining is worn out. Now here's what berberine does. Through AMPK activation, that same master switch, berberine enhances the activity of an enzyme called endothelial nitric oxide synthase, ENOS. This is the enzyme that produces nitric oxide in your endothelial cells. Research published in Cardiovascular Research demonstrated that berberine enhances the phosphorylation of ENOS in a dose-dependent manner. More berberine, more ENOS activation, more nitric oxide, more vascular relaxation. Let me make this real for you. Imagine your blood vessels as garden hoses. When they're new, they're flexible. You can bend them, squeeze them. They bounce right back. Water flows through easily. Now imagine those hoses after 30 years in the sun. They're stiff, cracked, inflexible. If you try to push water through at the same rate, the pressure inside goes up. Not because there's more water, because the hose lost its give. That's your arteries after 60 years of oxidative stress, chronic inflammation, and declining nitric oxide production. The vessels themselves have become rigid. The heart has to push harder. Your blood pressure goes up. What berberine does, through AMPK and ENOS, is help restore flexibility to those vessels. Not by forcing relaxation from the outside like a medication does, but by giving the endothelial cells what they need to repair themselves, to produce nitric oxide again, to be supple again. But it doesn't stop there. Berberine also reduces the oxidative stress that damages endothelial cells in the first place. It decreases the production of reactive oxygen species. Those are the free radicals you've heard about. It inhibits the activation of NF-κB, a master switch for inflammation. It reduces the expression of adhesion molecules that allow immune cells to stick to your blood vessel walls and trigger the chronic inflammatory cycle that drives atherosclerosis. In animal models of hypertension, specifically spontaneously hypertensive rats, berberine reduced blood pressure by inhibiting endoplasmic reticulum stress in the carotid arteries. It literally reduced the cellular stress response that was making the arteries stiff and resistant. And here's what the human data shows. In the meta-analysis of randomized double-blind trials with intervention periods of at least 3 months, berberine produced significant reductions in both systolic and diastolic blood pressure, not dramatic drops. We're not talking about a medication that slams your pressure down by 40 points. Berberine's effects on blood pressure are more modest, typically in the range of 5 to 10 points systolic. But here's why that matters. For someone with borderline hypertension, stage 1, sitting at a 135/88, a consistent 5 to 8 point drop might be the difference between you need medication and let's keep monitoring. That's meaningful. That's life-changing for someone who doesn't want another pill. And remember, this blood pressure benefit is happening on top of the blood sugar improvements and the cholesterol improvements. You're not adding a fourth medication to manage a side effect. You're getting 3 benefits from one intervention. So let me put this together for you. Berberine lowers blood sugar by activating AMPK, which enhances glucose uptake into cells and reduces liver glucose output. Berberine lowers cholesterol by increasing LDL receptor expression on liver cells through a pathway different from statins, while simultaneously reducing LDL oxidation. Berberine lowers blood pressure by restoring nitric oxide production in your endothelial cells and reducing the inflammation and oxidative stress that cause vascular stiffness. 3 conditions, 1 mechanism family, 1 compound, and all 3 effects have been confirmed in peer-reviewed, randomized, controlled clinical trials. You know, this is exactly the kind of information that makes me frustrated with how healthcare works for people over 60. Because you're dealing with all 3 of these issues simultaneously, the blood sugar, the cholesterol, the blood pressure, and nobody is connecting the dots for you, especially at night when your blood pressure dips and surges, when your liver is dumping glucose, when your cortisol peaks before dawn. That entire overnight pattern is what I covered in The Midnight Insulin Trap. It walks you through building a nighttime system that actually works with these mechanisms, not against them. The link is in the description below. But we're not done here, because there are 4 combinations that can make berberine genuinely dangerous. And you need to hear these before you take anything. Stop. This section is not optional. Berberine is powerful. That's the point. But powerful also means it interacts with things. And some of those interactions are serious. If you take any prescription medication, this section could be the most important 5 minutes of the entire video. Critical mistake number 1. Berberine. Metformin without medical supervision. This is the most common mistake I see. Someone watches a video about berberine, gets excited, and adds it on top of their metformin without telling their doctor. Both berberine and metformin lower blood sugar through overlapping pathways. Both activate AMPK. Combining them without dose adjustment is like doubling your medication. You risk hypoglycemia, dangerously low blood sugar, shaking, confusion, dizziness, falls. If you're on metformin and want to try berberine, you must involve your doctor. They may need to reduce your metformin dose, or they may want to monitor your blood sugar more frequently during the transition. Either way, they need to know. Critical mistake number 2. Berberine plus statins at full dose. Remember what I said about berberine and statins using different pathways to increase LDL receptors? That synergy is powerful. But it also means that combining full-dose berberine with a full-dose statin can lower your cholesterol too aggressively. More importantly, berberine affects how your liver processes certain drugs. It inhibits specific cytochrome P450 enzymes, the same enzymes your liver uses to metabolize statins. This can increase the effective concentration of the statin in your blood, potentially amplifying side effects like muscle pain, liver stress, or rhabdomyolysis. If you take a statin, talk to your doctor before adding berberine. Period. Critical mistake number 3. Berberine plus blood pressure medication without monitoring. Same principle. If berberine is enhancing nitric oxide production and improving vascular function, and you're already on a blood pressure medication that's forcing your vessels to relax, you can end up with blood pressure that's too low. Hypotension in someone over 60 is dangerous. Dizziness, lightheadedness, falls. A fall at 70 can change the trajectory of your entire life. Monitor your blood pressure daily if you add berberine. Keep a log. Share it with your doctor. Critical mistake number 4. Berberine plus certain antibiotics. This one catches people off guard. Berberine can interact with a class of antibiotics called macrolides: erythromycin, clarithromycin, azithromycin. These are commonly prescribed. If you get a sinus infection next month and your doctor writes you a Z-Pak, they need to know you're taking berberine. The interaction involves the same liver enzymes I mentioned. the cytochrome P450 system. Berberine can increase the concentration of these drugs in your blood beyond what your doctor intended. And while we're talking about drug interactions, cyclosporine is another one. If you've had any kind of organ transplant and take cyclosporine, berberine is off the table. The interaction is too significant. Same goes for certain blood-thinning medications. Berberine may enhance the effects of warfarin and similar anticoagulants. If you bruise easily or take any blood thinner, your doctor must be in the loop. I want to say something clearly. I am not trying to scare you away from berberine. The safety profile in clinical trials is genuinely impressive. Most studies report side effects comparable to placebo. Mild GI issues are the most common complaint, and they usually resolve within 2 weeks. But safe in clinical trials and safe for you specifically are two different things. Because clinical trials exclude people on complex medication regimens. They exclude people with liver disease. They exclude people over 85. If you're a 72-year-old taking 6 medications with moderate kidney function, you're not the patient from the trial. You're a different patient. And that means talk to your doctor first. Also, and this is important, berberine can affect gut motility. It was originally used for diarrhea, remember? Some people experience gastrointestinal effects, cramping, constipation, nausea, especially when starting at a high dose. This is why the titration protocol matters. Start low, build up gradually. Give your body time to adapt. I'll cover the exact ramp-up schedule in a moment. Let me be direct with you. I am not your doctor. I don't know your medication list. I don't know your kidney function or your liver enzymes. What I can do is show you the evidence and give you the tools to have an informed conversation with someone who does know those things. That conversation is your responsibility, and it matters. All right, you've seen the evidence, you've heard the warnings. Now let's talk about what the clinical trials actually used. The most commonly studied dose in the literature is 500 milligrams, taken 2 to 3 times daily. That's a total daily dose of 1,000 to 2,500 milligrams. But here's the mistake most people make. They buy a bottle, take 500 milligrams on day 1, feel terrible, nausea, cramping, maybe diarrhea, and throw the bottle away. Don't do that. Here's the protocol I've seen work best, based on the clinical literature and the feedback I've received from this community. Week 1 and 2. Start with 500 milligrams once daily. Take it with your largest meal, not on an empty stomach. The food helps buffer the gastrointestinal effects and improves absorption. 1 pill, 1 meal, 2 weeks, week 3 and 4. If you tolerate the first 2 weeks well, no significant digestive issues. Increase to 500 milligrams twice daily. Once with breakfast or lunch, once with dinner. Week 5 onward. If you still tolerate it well, you can increase to the full study dose of 500 milligrams 3 times daily with meals. But honestly, many people see excellent results at 1,000 milligrams total. The jump from 2 to 3 doses is optional and should be based on your numbers and how you feel. A quick note on timing. Some people ask me whether berberine should be taken before meals, during meals, or after meals. The answer from the literature is with meals, meaning at the same time. You want the berberine in your system when the food hits. This does 2 things. First, it reduces the GI side effects because the food buffers the compound. Second, it means berberine is actively working when your blood sugar starts to rise from the meal. The post-meal glucose spike, the one that does the most damage, gets blunted in real time. If you can only remember 1 dose a day, take it with your biggest meal, the meal with the most carbohydrates. That's where you'll get the most benefit per capsule. And one more practical thing. Store your berberine at room temperature. Keep it dry. Don't leave it in the bathroom where humidity builds up. And check the expiration date. Berberine degrades over time. An expired supplement isn't dangerous. It's just weaker. You're getting less than the dose on the label. Now, what form should you buy? Berberine hydrochloride is the most studied form. That's what was used in the vast majority of clinical trials. not berberine sulfate, not berberine from a proprietary blend where you can't tell how much actual berberine is in each capsule. Look for berberine HCl on the label, and look for third-party testing, USP verified, NSF certified, or at minimum a certificate of analysis from an independent lab. The supplements that say berberine complex, or berberine plus 12 other ingredients. Skip those. You don't know what you're getting. The research was done on berberine alone. Take berberine alone. One more thing. Berberine has relatively low bioavailability, meaning your body doesn't absorb it all that efficiently. Taking it with food improves absorption. Some newer formulations use technologies like phytosomes or dihydroberberine to enhance bioavailability. These may be worth considering, but the evidence base is smaller. If you want to stick with what the science has validated, standard berberine HCl with food is your safest bet. I want to set realistic expectations, because berberine is not magic, it's science, and science takes time. And honestly, some of the best results I've seen reported come from people who were patient enough to give it a full 12 weeks before judging. Week 1, you probably won't notice much externally. Maybe some digestive adjustment, a little rumbling, maybe looser stools, or the opposite. That's normal. Your gut microbiome is adjusting. Berberine actually has antimicrobial properties, remember? It was used for diarrhea for centuries. So your gut bacteria are being rebalanced. This settles down. If you're testing your blood sugar, you might notice a slight dip in post-meal numbers. Maybe 5 to 10 points lower than usual. Nothing dramatic. Don't get discouraged if you see nothing yet. Week 2 to 3. This is where the original 2008 Shanghai study showed the first significant drops in fasting blood glucose. The researchers saw fasting glucose start declining within the first week and continue dropping through week 5. If you're testing, you might see your fasting morning number drift down by 10 to 20 points. Maybe more, maybe less. Individual variation is enormous here. Your age, your baseline insulin resistance, your diet, your activity level. All of these affect the speed of response. But here's what a lot of people notice in this window that isn't about numbers. Energy, mental clarity, less afternoon fog, less of that post-lunch crash where you just want to close your eyes for 20 minutes. That's the AMPK activation at work. Your cells are starting to burn glucose more efficiently instead of letting it pool in your blood. Week 4 to 6. Cholesterol changes typically start showing up on blood work around this time frame. The LDL receptor upregulation takes time to translate into measurable serum changes. Your liver has to physically produce more receptors, clear more LDL, and that clearance has to persist long enough to change your circulating levels. If your doctor orders lipids at the 6-week mark, you may see the first meaningful movement. Triglycerides tend to respond faster than LDL. If your triglycerides were elevated, you might see them drop noticeably by week 4. Week 8 to 12. This is where the full effect emerges. The meta-analysis showed HbA1c reductions of 0.7 to 2 percentage points over 3 months. Triglyceride reductions became statistically significant across all study populations. Blood pressure improvements emerged in the longer trials, typically after 8 weeks of consistent dosing. And this is the window where the most powerful thing happens. You walk into your doctor's office with a lab sheet that looks different, numbers that moved in the right direction, without adding another pill. That is a conversation worth having. And it's the kind of conversation that starts with evidence, not hope, not hype. Evidence. The kind that's been accumulating for over 15 years in peer-reviewed journals around the world. So, here's my recommendation. Before you start berberine, get baseline blood work, fasting glucose, HbA1c, full lipid panel, a good blood pressure reading, not one taken when you're anxious in the waiting room. Take it at home, in the morning. 3 readings, 3 different days. Average them. Write it all down, all of it. Start the protocol. Take it for 12 weeks, consistently, with meals. At the dose your body tolerates. Then get your blood work repeated. Same tests, same lab. Compare the numbers side by side. If your numbers improved, and the evidence suggests they should for most people, bring those results to your doctor. Don't argue with them. Don't lecture them about AMPK and nitric oxide. Just hand them the before and after. Let the data speak. That conversation, that's how real change happens in healthcare, not through confrontation. Through evidence your doctor can see with their own eyes. I have a question for you, and I want a real answer. How many pills are you taking right now? Not counting vitamins, just prescriptions. 3, 5, 7, more? Drop the number in the comments below. Just the number. Nothing else. I want to see the pattern, because I think when we lay it all out, when thousands of people over 60 all post their pill counts in one place, we're going to see something that confirms exactly what I've been saying for months on this channel. The system isn't designed to heal you. It's designed to maintain you, to manage you, to keep you stable enough that you don't end up in the emergency room, but never healthy enough that you stop needing the prescriptions. 3 conditions, 3 pills, 3 copays, 3 sets of side effects, and every 6 months, the doses go up. What if one of those 3 could be addressed differently, not eliminated overnight, not replaced recklessly, but addressed with a compound that's been studied in 46 clinical trials and has a safety profile your doctor can verify? That's not wishful thinking. That's published science. And you deserve to know about it. If you believe that health information should come from evidence, not from whoever had the most persuasive sales rep in your doctor's waiting room last Tuesday, then subscribe. And share this video with someone who's taking 3 pills for 3 conditions. They deserve to hear this too. Seriously, think of one person right now. A spouse, a sibling, a friend from church. You know exactly who they are. Now, one more thing. This video covered what happens during the day, the mechanisms, the dosing, the interaction.